My name is Elise. I'm 49 years old. I've been married for 23 years to a fantastic man. We love to fly fish. I love being outdoors. I was a runner before my diagnosis. Now I'm a walker and enjoy that just as much. Just enjoy spending time outside, doing different recreational activities. I was diagnosed with stage 3A non-small cell lung cancer. I had been here in Montana for about a month and a half, and during that time I had started to experience a cough and a wheeze, which was unusual for me. And I went through some different diagnostics, an X-ray, a CT scan, and then ultimately a surgical bronchoscopy. I went in for the bronchoscopy and received the results within 2 days that it was adenocarcinoma. It was in my upper left lobe of my lung, very close to the center of my chest. It was absolutely shocking to receive that diagnosis. 2 days after I was diagnosed, I connected with another lung cancer patient through a mutual friend. He provided a tremendous amount of education. I had what I thought were no risk factors for lung cancer. I've never been a smoker. I was living what I felt was a quite healthy life. I was a runner. The pulmonologist felt that it was resectable, which was encouraging. And he immediately provided us with some important education. One was in regard to targeted therapies. I had no knowledge of targeted therapies at that point. He talked about biomarker testing, and he had already obtained tissue from the bronchoscopy and sent it to a lab for that testing. So when we met with my surgeon, he indicated that there were a couple different approaches for surgery. But I had read some things to prepare myself, and I had asked him a number of questions too. So I had surgery, and they took out my upper left lobe. 2 weeks after my surgery, I had a follow-up appointment with my oncologist, and we reviewed the pathology report, which gave us my stage, which was 3A. Based on my genetic mutation, EGFR, TAGRISSO was the best option for me.
TAGRISSO is a once-daily prescription pill used to help prevent non-small cell lung cancer with certain abnormal EGFR genes from coming back after surgery.
I really didn't want to be on any more medication at all. I had to reconcile that in my mind and just accept that I would be on a medication they said for 3 years at least. And it's just that fear of the unknown, really, when you boil it down. But I definitely took that pill bottle out and put it on a shelf, and would kind of walk by it every now and then and give it a bit of a stink eye. And I think a big part of that was fear, because I wasn't sure what kind of side effects I might have from the medication. It's just that fear of the unknown. But at the same time, I thought back on my dad who had battled cancer, and he would have given anything to have any treatment that would help him. So I try to channel him and just flip it and have an approach of gratitude that I'm lucky to have this option. I have knowledge now of how it affects my body, and it's not been anything that I can't handle, I can't deal with. I've had some GI disturbance, so to speak, and I've had some ingrown toenails, but my medical team is fantastic about helping me through those side effects. TAGRISSO for me, it allows me to live my life. I mean, I'm in Montana fly fishing right now. I can travel, and for me, that's a real gift.
TAGRISSO osimertinib is an FDA-approved oral targeted therapy used to help prevent non-small cell lung cancer with certain abnormal EGFR genes from coming back after removal by surgery. TAGRISSO may cause serious side effects. Some may be severe. These could lead to death. Tell your healthcare provider right away if you have new or worsening lung problems, such as trouble breathing, shortness of breath, cough, or fever. Heart problems such as pounding or racing, swelling of your ankles and feet, dizziness, feeling lightheaded or feeling faint. Eye problems such as watery, red, sensitive, or painful eyes. Skin problems such as skin reactions that look like rings or severe blistering or peeling of the skin. If you develop signs of inflammation of your blood vessels in your skin, including purple spots or redness of your skin on your lower arms, lower legs, or buttocks, or large hives on the main part of your body that do not go away within 24 hours and look bruised, or if you develop signs of blood and bone marrow problems, including new fever or fever that does not go away that is greater than or equal to 100.4 degrees Fahrenheit, easy bruising or bleeding that will not stop, unusually pale skin, infection, tiredness, or weakness. Tell your healthcare provider about all your medical conditions and any medicines you take, and if you are pregnant or plan to become pregnant or are breastfeeding. The most common side effects of TAGRISSO when given alone are low white blood cell counts, low platelet counts, low red blood cell counts, anemia, diarrhea, rash, muscle, bone, or joint pain, changes in your nails, dry skin, mouth sores, and tiredness. These are not all the possible side effects. Please see full important safety information and complete prescribing information, including patient information for TAGRISSO on tagrisso.com. If you can't afford your medication, AstraZeneca may be able to help.